Fight over the shutdown and the debt ceiling behind us for now. More attention will likely shift to Healthcare.gov and those glitches that have plagued the site for the last 2 weeks. A memo obtained by the Associated Press shows the Obama administration projected that nearly 500,000 people would sign up for the health insurance markets. But despite around-the-clock repair efforts, many Americans are still having trouble even logging on to see what insurance plans are available. Yesterday, Health and Human Services Secretary Kathleen Sebelius addressed those concerns while speaking at a school in Cincinnati, saying, quote, "There have been vast improvements, but we are still not satisfied." Tom Costello joins me now live with more on the troubled rollout. So it's hopefully improving.
Well, that's what the White House says. That also says 15 million people have now visited the website, and it insists the site is starting to get people who are getting through and signing up, but it isn't saying how many people have done that. By some estimates, we could be talking about less than 1% of the website traffic. If the Obamacare website were a patient, it would probably be in intensive care by now. More than 2 weeks after its rollout, Healthcare.gov is getting failing grades from supporters.
I hope they fire some people that were in charge of making sure that this thing was supposed to work.
And the White House itself.
Despite the glitches that we acknowledge and that absolutely must be fixed, people are getting on and enrolling.
The Washington Post has called it a complete train wreck. The Milwaukee Journal Sentinel says the administration needs to fix the problems and fix them now.
At Healthcare.gov, where live web chat assistance is also available.
Not right now, it's not.
On October 1st, we met the Schultz family in Phoenix, eager to sign up for insurance through the federal website. 17 days later, they still haven't been able to finish the process.
As time went by and we realized that this was taking longer than expected to sign up, the excitement became more like a question mark, but we're not giving up.
When you see this as a software programmer, what does it say to you?
Amateur hour. It looks like it was created by someone who's never delivered commercial software before.
Luke Chung owns a software programming company in Virginia.
A user should never see this. This would barely make beta testing. All right?
One potential problem, the website demands users input their personal information before they even begin to window shop for insurance, something retail websites like Amazon.com don't do. Programming experts say a lot of work needs to be.
If they don't change management, this project is doomed, because we've already seen what the existing management considers ready for shipping, and it's not.
Now, there are allegations that the administration waited too long to draw up the blueprints for the website, then had too many contractors involved. Meanwhile, many of the state websites that are running their own sites are getting very high marks for how well they're running, Colorado and Kentucky in particular. Thomas?
Tom Costello, thanks so much. We're joined now by Washington Post White House reporter Juliet Alperin to talk more about this. And Juliet, you recently wrote about how the website glitches, they've been scaring off users, customers. Noted between October 1st, when the exchanges went live, and October 13th, that the visitors to the site plummeted by some 88%. You even break it down to show how many have visited to where we're able to successfully just log in. So how is the White House supposed to respond to this? Because is the onus supposed to be on the state and the healthcare exchanges set up, or the federal government taking responsibility for it? Or is this a purposeful way to make it look so messy so that there has to be something more done?
Well, this particular question is really one for the administration, because what we're talking about with these numbers are the federal health insurance exchanges, which the United States government and the Obama administration is running in more than 30 states. So, as your reporter indicated, some of the state healthcare exchanges are doing quite well, and it's really the enrollment system on the federal that the federal government is in charge of. Those are the ones that are in trouble. So they're the ones who are in charge of fixing it, and they have been very wary of disclosing any numbers that would give the public a sense of how they're faring right now.
All right, so as we